With the fallout of government COVID-19 related restrictions starting to boomerang back around,
I honestly think a mask mandate would be the furthest we'd have to go.
guess what the same government health overlords are resorting to in an attempt to compensate for this new viral trifecta on the rise, primarily in children?
It's not across all age groups. It is the youngest that cannot mask or would obviously have difficulty in masking, and we need to protect them. It's 4 and under that are really having the increased risk of hospitalization and to be in our intensive care units today.
That's right, community masking, once again. Tamara Ugolini here with Rebel News to remind you of a time when the government and health hysterics repeatedly told the public to trust the experts and follow the science.
If we don't act now, it's going to get worse. And if we don't act now, we're going to be in much worse shape in a week down the road or 2 weeks down the road.
And now that we are 1,000 days into rolling COVID-19 related restrictions after being sold on that slogan of 2 weeks to flatten the curve nearly 3 years ago.
You've heard public health officials and myself say many times that we need to flatten the curve or plank it.
Into what health officials would have you believe is the deadliest pandemic since the Spanish flu of 1918. It's a pandemic, though, that has a very controversial death rate, and our health overlords continually fail to follow the science. Instead, they're relying heavily on behavior modification and peer pressure to try to solicit compliance with masks and vaccines. For instance, at his press conference yesterday, Ontario's Chief Medical Officer of Health, that's Dr. Kieran Moore, is highly recommending everyone wear a mask indoors, including toddlers. Have a listen.
The best way to prevent the flu is by getting the flu shot every year. You can also get your COVID booster safely at the same time for those over 5. With the peak of flu season expected in early to mid-December, the time to get your shot is now. Please do not delay. It is not too late to get protected. And in response to the worsening trends and existing challenges for our healthcare system, I'm strongly recommending that all Ontarians, not just those at high risk, wear a mask in indoor public settings, especially around our most vulnerable Ontarians, the very young and the very old. I'm also recommending that, if possible, children between 2 and 5 wear a mask with supervision if they can tolerate the mask and safely put it on and off. Applying all these layers of protection will help to protect ourselves, our families, and most importantly, our children under 5.
This means that mask mandates aren't coming back to Ontario, at least not yet. Yet a mask mandate is not out of the realm of possibility, so we have launched a petition at nomoremasks.ca, which calls on health authorities to never again implement unscientific, indiscriminate mask mandates. The science does not justify this arbitrary measure, and Moore himself admitted that mandates have not worked in the past. Again, have a listen.
But we need us to mask around those most vulnerable in social settings, which mandates haven't worked for in the past. At family gatherings, at family social situations, we have to mask to protect those that are the youngest among us, those that are 4 and under.
Because after 2 years of bubble wrapping children from normal societal interactions that would traditionally build up their immune system, we have masked and sanitized them almost to death. And now the health overlords are crying wolf. Not one mention, though, of the shortage of antibiotics for children as described by this pharmacist.
You would like to add to the point that you said that there's a shortage of Tylenol as well as Advil. There's a shortage of 2 things that are extremely difficult for us to manipulate or make. And these are the 2 most commonly dispensed antibiotics for kids, amoxicillin and azithromycin. And not enough is being said about those. If we cannot treat children in a community setting, this is going to spell a larger disaster for hospitals, as hard as that is to even imagine. So this needs to be addressed as well. I'm really not sure at what point do we refer to this as an emergency. At what point do we have our politicians actually address this in a more urgent fashion?
Apparently, masks will save us from decades-old inept government healthcare failures. Perhaps instead of pushing vaccine uptake and building a new manufacturing facility like the modest $180 billion Moderna manufacturing facility in Quebec,
Aujourd'hui, l'annonce de Moderna de construire une usine au Québec est un pas de plus dans la bonne direction. Cette nouvelle usine de Moderna va pouvoir fabriquer jusqu'à 100 millions de doses de vaccins à ARNM par année.
which will, get this, manufacture vaccines against COVID-19 and other respiratory viruses, including influenza and respiratory syncytial virus, or RSV. Interestingly, those are the very same viruses responsible for the health hysteria happening right now. Perhaps instead of focusing on building that capacity, we could build hospital capacity, correct the crisis in staff shortages, and ensure that we have childhood medication in times of need. And all of this perhaps could have been avoided. But no, the tools in the toolbox are continually just masks and vaccines. They cure every societal healthcare woe now. They work so well that we have to keep using them. What's that definition of insanity again? I think it's doing the same thing over and over and expecting a different result. Sign our petition at nomoremasks.ca. For Rebel News, I'm Tamara Ugolini. If you know more about masking now than you did in the early days of 2020 and will not comply with another mandate, then consider signing our petition at nomoremasks.ca. We'll continue to report on this topic and uphold freedom of personal, informed choice. Follow along at nomoremasks.ca and sign our petition.